anybody has probably seen me, Stacy is my counterpart, but she had to leave a little bit earlier today. My name is Debbie. I'm one of the nurse educators, the COVID nurse educators. So what happened, how we got to be here, is the state of Hawaii contracted with ProLink agency. It's a nursing staffing agency from the CARES Act, and they wanted to be very proactive to be able to say, we want you to kind of go into our vulnerable communities, our facilities that are the most at-risk patient population, which is of course our long-term care facilities, and kind of help to oversee any kind of infection control, certainly your COVID plans, your mitigation plans, and any kind of teaching that we can do. Certainly, COVID kind of hit us really by a storm, so they really wanted, for the state of Hawaii's credit, they wanted to be a lot more proactive to be able to kind of see what does these facilities really need. In your case, that it's obviously known that you had one positive patient that you took care of, that you isolated, that actually returned back to health, and that it was not spread to any other resident, and it was not spread to any other staff. And so you really have to give yourself so much credit, give yourself a pat on the back for that, because that is noticed within the industry as far as you setting the standard as far how to handle a very, very scary situation like that. So definitely, you deserve a lot of credit for that. I'm actually from Chicago, and I can tell you that a lot of our facilities are not as either diligent, lucky, or proactive in that state. So a little bit about me. I've been in nursing for many, many years. I like to consider myself aged like a fine bottle of wine. That's how long I've been in nursing. Started out in emergency medicine, ICU, basically pediatrics was my specialty. Went back to graduate school, so I'm a pediatric nurse practitioner, but I also teach within nursing programs. And so I'm an assistant professor as well, particularly in clinical. So I do have experience in long-term care, a lot of teaching. I love teaching, love being in front of people. Probably can tell that I'm not really shy, a little bit of a people person, so I like hearing my talk. Am I talking loud enough for you? Perfect, okay. So to start off with, one of the things that your nursing management wanted us to kind of cover when we went through the mitigation plan was competencies, skills, teaching, the basics, hand hygiene, PPE, and transmission-based precautions. So those are the three things that needed to be covered, because now when these surveyors are coming back in, your Department of Health, that's another reason why we were brought in, to make sure that not only the infection control thing was really taken care of, was that you felt comfortable, at least with your skills, and if you're not with your skills, as far as knowing who to ask, knowing who to say, hey, can you check this out? Am I doing this the right way? Where do I get this information from? So that is our purpose for today. So coming through with it, when they asked me last Friday to do competencies, I said, oh, of course, yeah, I'll help you, that kind of thing. And then trying to feel out, how do I make hand hygiene exciting, new, and different? Anybody that's been working in healthcare probably for longer than a day, how many times that you've heard about hand hygiene? How do I make this exciting? How do I make this enough that you don't want to go to sleep? And it's a very good challenge, especially at 6 o'clock in the morning when everybody wants to go home. And I'm sure you're tired too, so I'll talk fast and we'll get you out of here, okay? Hand hygiene, I'm not going to go through the basics. As far as I know that you're very well educated on that. There's two different forms. You have your soap and water, and you have your alcohol-based, right? Alcohol-based is actually, from the CDC standpoint, what they prefer that healthcare facilities use. Why? Because it's more prevalent, it's easier to use, it's a little bit better on your hands, not as drying as soap and water can be. And actually it can kill more pathogens as well. The issue is, how often do we do it can be a little bit on the interesting side. The CDC also did some research and said that according to their research in a normal healthcare facility, healthcare workers do hand hygiene 50% less time than they really should. So think about that when you kind of challenging every single session, that when you go to work back tomorrow or the next day or something like that, to kind of count and keep a mental count of how many times you actually wash your hands or use that hand sanitizer. If say If it's 30 times, 50 times, think that over and see how you can double that. Can you do that the next time, saying, okay, I'm doing it 50 times, maybe I need to do it 75 times. Where can I fit that in? What can go wrong if I don't? Okay, we know that the magic number with washing our hands, whether it's alcohol-based or the soap, is, anyone want to give a stab at the number? How long? How long are you supposed to do it? Come on, you're gonna be on tape forever. You can get the right answer. 20 seconds. 20 seconds is what is scientifically proven to actually kind of minimize the pathogens that's on those hands, all those germs, okay? The biggest issue is not only the 20 seconds, but how you do it. I remember being back on the floor. I remember being busy. I remember having 10 different things having to do that was supposed to be done 10 minutes ago. And you get very, very busy. And so we wash our hands very, very quickly. Kind of put that stuff on there. You're just kind of slapping that on, and we kind of go. The problem is that it's not effective in that manner. It has to be that 20 seconds, whatever it takes for you to remember that, whatever song you want to sing, however you want to count, it needs to be rubbed for 20 seconds on your hands, in between those fingers, under those fingernails. That's where we find a lot of that bacteria. Under those fingers, around those rings. If you could take the ring off or not wear rings, that would be wonderful. Actually, surveyors will come in and actually, I want to ask you, how did you wash your hand? You have that wedding ring. Show me how you wash that. So you got to kind of tell them, I kind of slip it off or not wear it. I'm under the ring because that's where the bugs like to live. And also those wrists are a really big place for those bugs. Just to kind of get up there, certainly if you wear a watch as well. All right? So true or false? True or false? If I wear gloves with the patient, I don't have to do hand hygiene. True or false? False. We always want to do some kind of hand hygiene, preferably that alcohol-based, if we're after a patient care, after we take our gloves off. When do I have to use soap and water? Even after the alcohol-based. You want to give a stab on it? When do I have to? Absolutely must. When they're visibly soiled, yes. Visibly soiled after you do any kind of dressing care, any kind of dressing, certainly open wounds. You've done that. You want to wash your hands with soap and water as well. There's one more. You're taking care of a patient. He has a little bit of an issue. We don't know what it is yet. You're kind of going in there a lot, having to wipe up, clean up. Come on, take a stab at it. It's brown. It's loose. Diarrhea. Anybody with diarrhea, that's going to be on film too, so thank you very much for letting me act that one out. So any patient with diarrhea, we don't know what that is, right? We don't know that if it is C. diff or not, which is very, very contagious, has those spores in them that is not cleaned and not taken away or not killed by that alcohol-based hand sanitizer. That is why you must use that soap and water very well after those patients, whether you know that they have it or not. You don't want to take that chance. You don't want to get it yourself. You don't want to give it to another resident. You don't want to take it home with you. Okay? Here's another question. How long do you think that the active COVID virus can live on skin? Who says 10 minutes? Who says 2 hours? I'm going to say 8 hours? You'd be close. Actually, the CDC actually did research, and they used it on cadavers because no one wanted to volunteer to say, okay, put the virus on me. We'll see how long it lives on me. And they used cadavers and saw that the active virus, not just it didn't die, and it was like kind of living there, it was active, it was able to be contagious for 9 hours on skin. Now, coupled with that, if you put that in secretions, droplets, mucus, that's the way that it actually comes out of us, it can live up to 12 to 14 hours, okay? So it's not just living on skin, it's living on surfaces, okay? So it's living on keyboards, it's living on pens, it's living on shoes, on our face masks, on anything that you can, doorknobs, phones, copiers, anything else you can think of. That is why I can't impress upon you enough to know that, oh my goodness, that at least COVID we know alone can last that long. To be able to use that hand hygiene to truly get that off of your skin and keep yourself healthy. any questions with hand hygiene, any practices that you've seen in the past that are questionable that you want to bring up and make fun of those people about? Here's a question for you that actually came up a couple days ago. True or false? If I wear gloves, I can go from one patient to the next as long as I do alcohol wipe in between. I can use those same gloves. Obviously, it's going to be false, right? We want to change gloves after every single patient, okay? Gloves is something that we don't feel the need to conserve one bit, okay? Let's move on to PPE now. So PPE was a big thing, obviously, back in March, when COVID really started coming up and being very, very dangerous in facilities and a lot of hospitalizations. The PPE shortage came into play as far as not enough gowns, not enough masks, all that, face masks was a big thing too. So CDC had to come up with a way, what's the safest way that we can do some kind of conservation issues with them? And the two ways that they came up, one was extended use, the other one was reusability. Now those of us that have been in nursing for quite some time, and I'm sure you might feel the same way, that the idea of having to reuse this PPE, especially gowns, can be a little bit nerve-wracking and something that we may not really feel comfortable with. So hopefully after we kind of talk about this, you can understand why and if your facility wants to enact this. So the reusability means that it's one patient, one healthcare worker, one shift. So if I'm taking care of a patient, I'm one healthcare worker, I have my one patient, as long as I'm on that shift, I can use that one gown, that's reusable gown. All right? If the extendability is, if I'm taking care of 2 or more patients that have COVID, the same diagnosis, I can actually go use the same gown in each one of those rooms. I need to change my gloves, but the gown can stay the same. Okay? When you take that gown off, you're going to want to I've seen when I've walked around, you have hooks by the door, the patient's door inside. You can actually hang that on the hook. You want the contaminated side, the front side, to be facing out, not on the wall, but facing outward. And then what I highly, highly suggest is you put like some kind of sticker on your hook so it designates that's your gown and no one else should use it, okay? One thing to think about too, because we're always busy, we're always rushing. Let's just say that I'm just rushing into this patient's room really, really fast. I'm just going to grab this one because I don't want to open up a new one. I'm going to grab this. How can you be 100% sure that the person before you used every single precaution in their power to make sure that the inside and that outside, that's what's going to be against you, is not contaminated? You can't, right? So you're putting yourself at risk and you're putting that patient at risk as well, okay? Since nursing management actually wanted, we were hoping that everybody could play with the PPE so I could see how you take on and see how you take off. Surveyors will actually come and want to see how you do this as well. But unfortunately, since we don't have enough of that supply, I'm going to be your person, I'm going to be the person putting it on. You're going to tell me how to do it. So I already have my mask on. I would have my face shield on as well. What should I put on first, my gown or my gloves? I'm going into a droplet precaution room. So we know from droplet precautions, I'm going to need a mask at the very least, face shield, gown, and gloves, correct? In a COVID-19 room, it's also, the policy might kind of change to say that you need an N95 as well, okay? So I'm putting my gown or my gloves on first. Gown, right? All right. Okay. Now you don't have to raise your hand to this question. I don't need a number, but I want you to think in your head, how many people actually tie the back? Okay? If you're like me, and I was much in a rush, many times, I did not tie it. I will definitely confess to that one. So what happens when you don't tie it? Everybody's going to be able to relate to this one. You run into a patient's room, I just have to go check to see because that light's on. The light's on again. It's the 10th time you did it this hour, so I'm going to go run in. I'll be there for less than 30 seconds. You get in there, he needs help. Either needs to get to a chair, back from the chair to the bed to whatever's happening. So you wind up kind of bending over. What's going to happen when you're bending over? All of a sudden, you're not gowned anymore. And God, whatever's happening, you're pulling it up like this. Your hands are contaminated, and everything kind of gets germs on yourself. So I implore you to tie it in the back. Okay? I'm going to put my gloves on. My hands are kind of sweaty, so it's going to be fun to put these on. You always want to go over your cuff, making sure that all your skin is covered. Again, you don't want anything that even that you can't see to be taken out of that room that you don't know. And it could hurt you or somebody else. So I got my gloves on. I can go into my patient's room. I did my droplet precautions properly. I took care of them. And now I'm going to walk out of the room with my PPE. I'm going to go do my charting. I'm going to go get his water. I'm going to go get his meal tray. Right? I got my PPE on. No. Surveyors would foam at the mouth if they saw you do that, right? They don't want to see you kind of walking out, and this has happened in the past, is that, we're in a rush and you're coming out. Maybe you want to see how you're going to wear your gloves when you're bringing trays back in and out of a patient's room as well. Are you going to take those gloves off before you go into someone else's room? Okay? So I'm standing in my patient's room before I relieve that threshold, kind of stepping over that threshold to take my PPE off. What am I going to take off first? My gloves, right? All right. So do I take my gloves off like this? Can I pull them off just from the fingertips? No, because you're going to rip them. Or have a tendency to rip, right? You want to take them off at the dirty side of the cuff, pull them out, and then now my clean finger, I can go under my cuff and pull that over like so and drop that in the garbage, right? Then I can take my gown off. Another way to take PPE off, especially if you're going to actually throw that away, if it's going to be disposable, you can take your gown and gloves off at the same time, correct? So this is the one that you can actually kind of pull off like this, because obviously it's going to be tied in the back. I'm going to dispense it in the biohazard, so I can pull it off with my gloves. So I don't want to touch this with my bare hands because this is the contaminated part. So I got my gloves on, pulling it off in the front, folding it over, and then I can pull off my gloves and the gown at the same time. You always want to make sure that when you're taking it off, that the contaminated side is away from you. It's arm's length. You're going to fold it away from yourself, right? And then throw that in the garbage. Obviously, you contact your EVS department for any kind of supply issues. They are very much in tune as far as how much the facility needs in anticipation of any kind of COVID need or outbreak. Any questions? Okay. I'm going to go over transmission-based precautions very, very quickly. Is that going to be in your way? Okay. So transmission-based precautions, we know that there's someone on COVID positive person's going to be on all three, on contact, on standard contact, and droplet, right? It is debatable that if they needed some kind of nebulizing treatment, something that they'd have to breathe out into the air, they would actually have to be on airborne too, and that's something that would have to be addressed with the facility to see if that can be accommodated, because we don't have negative pressure rooms set up for them, correct? So one of the biggest things with the the transmission-based precautions is obviously knowing what you're getting into, knowing what signage. Signage is a huge component. Surveyors are going to ask anybody that's going into the room, especially if you're assigned to that patient, what kind of precaution is this person in, as well as they might even ask you what pathogen is the issue. Is this person on MRSA? Is it C. diff? Is it COVID? And why is this person COVID here, or is it a PUI? What's happening with that? So under your Cardex, under any kind of reporting that you do, that communication is going to be vital for you to know not only that this person is in some kind of contact isolation or some kind of droplet isolation, but to understand too why, what pathogen are we talking about at that point. Okay? Any questions so far? I'm going to actually hand you over to Darren. He's going to kind of talk to you about the vaccine that's coming out. Before that, let me give you your little test. and we'll kind of go through that, and I'll let him know that you're ready in about 5 minutes. Okay?